I support and serve a board member for various groups for like European from Albach, and my work is focused on refugees and migration issues and improving healthcare pharmaceutical system in developing countries and empowering women. This Zoom meeting was initiated by the Vienna Institute for International Dialogue and Cooperation, Jamal and I, to further explore the diaspora organization and individual who are doing exceptional, amazing work in the unprecedented time. Today's topic will focus on Somalia Diaspora Community in the midst of the COVID-19 global pandemic. I will co-moderating today with Jamal and France, who are our technical host. And we invite you to use the chat room to ask any question to anyone. Your question will be directed to the person that you have indicated. We would like to give our speaker a few minutes to introduce themselves and their work, and after that we will proceed further there. And without taking further time, I would like to ask Jamal to continue from here. Thank you again.
Thank you, colleague. Thank you, Suad. And thank you, everyone, for joining us today evening. I would like to introduce myself. My name is Jamal Mataan. I've been working as a community organizer and a social advisor for non-governmental organization for quite some time. I also work as an advisor to the Somali community organizations in Vienna. Essentially, my work is in migration, education, arts and culture. I also liaison between teachers and parents. I create sports activities and finding organizations that are suitable for different situations. So referring community members to go to certain institution where we think that they could get help or other problems will be solved. So we also create cultural events, creating community meetings, intercultural dialogues between organization and new Somali arrivals. So I'm also currently the organizer of the Horn Initiative. The Horn Initiative, it's in its beginning, it's in its inception stage now, whereby its work will be to professionalize community organization, to look for support systems to build sustainable structures for these new community organizations in Vienna. As most of the community work is run voluntarily, so we are looking on how to develop this Horn Initiative will help in creating networks, capacity building, knowledge, and how to share expertise with from different sides and also with different organizations. The Horn Initiative will look for partners and resources for cooperation within Austria, the EU, the UK, and the Horn of Africa in the countries of Ethiopia and Kenya. So I'm looking forward to hear all your inputs today evening, and I'll be the co-moderator today. And I would like now to ask our technical host, who is also the co-director or the deputy director of VIDC, the Vienna Institute for International Dialogue and Cooperation, to introduce himself and also to introduce the organization that is co-hosting today's event. Thank you. Please, Franz, you can go ahead.
Yes, thank you very much to all of you for your participation, and a special thanks to the speakers of today and to our moderators, Jamal Mataan and Suad Mohamed, who helped me to organize this first online meeting we are hosting now. My name is Franz Schmiediel. I'm working at the VIDC, and I'm in charge of the Africa Policy Desk, how we call it. The Vienna Institute for International Dialogue and Cooperation was founded already in the 1960s as a platform for a South-North dialogue. And today it's a kind of, I would say, think and do tank to promote a global dialogue on an equal eye level in the fields of democracy, gender, equality, and of course, diaspora engagement. Other departments we have are Kulturen in Bewegung, engaged in the fields of intercultural dialogue and fair play, promoting diversity and anti-discrimination in sports. Maybe you have seen, please, a technical remark, we will record it also for a kind of report afterwards we would like to produce. Yes, and now I want to thank you again for a fruitful and inspiring meeting, and hand over again to our moderators. Have a nice discussion.
Yes, thank you very much, Franz. Colleagues, we have initiated this evening because we have proposed a conference, a certain conference that Franz will speak about towards the end. And this conference is a diaspora networking conference that we'll speak about it later. But I would like now to go further into the program of today and invite Abdul Basit Abdi, because he will not be having a lot of time with us today, to ask him about the diaspora community that is living in Norway. Because we know that the Somali Diaspora Community has been living in Norway for quite some time, since the 1990s, if not even before that. So I would like to ask Abdi Basit to introduce himself, his work within the community, the Somali Diaspora Community, and yeah, his work, and then we'll be able to follow up with the COVID-19 question. Thank you.
And Assalamu alaikum to you guys. So I'm Abdi Basit Ali Rage. I am based in Oslo, Norway. By profession, I am a psychotherapist, and also consider myself someone who's advocating for mental health. And my aim is to, inshallah, get rid of the stigma relating to mental health. And Alhamdulillah, I had the opportunity to do this work in many different countries and many Somali communities, the Scandinavian countries, and as well as yeah, and Kenya, Ghana, Australia. So and the Somali community in Oslo is quite large. In Norway, we're about 45,000 Somalis, and the majority of the Somalis living in Norway, it came to Norway about 10, maximum 15 years ago. So the majority of the Somalis don't have that much of haven't stayed in Norway so long. So and I've been working with that, and also worked through the mosque. And as you probably heard about, and the issue with the Somali community and the childcare services in Norway, which had a huge challenge, it's been a challenge in the community. So those are my work experience, and yes.
Yes, I'll just follow up with a question. How is the COVID-19 global pandemic affecting Norway, because it has affected many places around the world, and specifically the Somali community in Norway? I mean, how is the situation currently?
So luckily, the situation today is very good. Norway is almost completely opened up, and things are almost back to normal. And but to begin with, the Somali community faced a huge challenge relating to this pandemic. We saw how things were going in Sweden, and we're trying to figure out how to prevent this happening in Norway. What happened was, to begin with, there was a lack of the testing opportunity were not so easy, and there's also lack of information. And culturally, we all know that we are very social people, so so we didn't fully understand how this was going to affect us, like many other people in this world. So what happened here in Norway was Somali itself, and a group of academics and young people and some elders gathered and took their own initiative to do something about this issue. And later on, the government came along to facilitate, because the cooperation with the government to start was not so good. So and alhamdulillah, we got that acknowledgement that because of our own initiative, that we managed to prevent and further spreading of the disease. And yes, so it was good.
Could you give us maybe one or two examples of those initiatives that you had that helped in mitigating the challenges, or in how to deal with the challenge of COVID-19 within the community?
Yeah, so this group of individuals, we consist of medical doctors and other social workers and other influencers within the community. So what we did was we made a telephone hotline for the community that we could assist people with explaining these and the symptoms and how to prevent, and also trying to educate them about their rights when it came to government aids and so on. So we had that hotline, and we had the WhatsApp groups, and we also, with the help of the government later on, the Oslo municipality, we had movies or short films where we spoke in Somali, and
they were translated.
Yes, they were translated in Somali context, and also because it was also Ramadan. Mm-hmm. Ramadan was getting near, and how to, and to have a pleasant Ramadan without the socialization part.
Yes, before I let you go, maybe I'll ask you the last question about mental health within the community and COVID-19. What was the relation between mental health and the well-being of vulnerable communities at the time of COVID-19? Because we saw some kind of spike of violence at home or domestic violence and things like that, which has shot up. So I wanted to ask you, as a mental health practitioner, what were the challenges at this time that you're working on?
Yeah, Jamal, that's a very good question. And we need to acknowledge that, like many others in the communities, not only the Somali community.
I understand. Yes.
Globally, it's been a very, it's a dramatic increase of domestic violence during these uncertain times. So from psychological point of view, so the COVID-19 and the whole situation was kind of new to us, because it was a long time ago since humanity faced a lockdown of this scale. So especially with the Somali community, remembering it could have been a trigger, because last time people were in such lockdown was during the war. So a lot of underlying issues came to surface due to this COVID-19 experience, and that itself sparked people who had some underlying issues, mental health issues, and the increase of domestic violence because of uncertainty. You know, people are very stressed, and people didn't know how this was going to affect financially, health-wise, and so thinking the problem is maybe due to the spouse or the kids, and was that clear?
Yeah. Thank you very much. Thank you very much. And Abdi Basit, thank you very much for joining us.
Thank you for having me.
Yes, thank you. I will go now forward to invite Dr. Idil. I think Dr. Idil is with us here today. Thank you very much for coming, Dr. Idil. Dr. Idil is a professor. Dr. Idil is an assistant professor in media and communication. She is a lecturer in media and communication at the School of Media, Communication and Sociology at the University of Leicester. And she has written extensively on diaspora, on media, diaspora, and the Somali conflict. And she has also written on Somalis in Europe.
Jamal, your voice is not clear.
Hello? Can you hear me now? Is it better?
Yeah, now it's better.
Yes, thank you. Dr. Idil has written extensively on media, diaspora, and the Somali conflict, and also Somalis in Europe, stories from the Somali diaspora. I would now like to ask the lady to introduce herself and her work before I ask someone.
Jamal, can you fix your voice a little bit, the mask on the mic or something?
Yeah, can you hear now?
Yes, there's some error there. Okay.
I think he have to keep it away from his clothes. So.
Okay, assalamu alaikum everyone. Bismillah ar-Rahman ar-Rahim. Thank you very much for having me. Thank you to Jamal, to Suad for inviting me, and to VIDC for hosting us. I say assalamu alaikum to the rest of you. So I'm really honored to join you guys, because we've seen a lot of activities that have been happening. The Somali community across Europe has really galvanized themselves, but we haven't been able to take a seat back and to come together and see how all of us are engaging with COVID-19 and tackling it. So this really is an opportunity of privilege for me to join you guys. I want to give you a brief synopsis of the kind of activities that have been happening here in the UK. As most of you are probably aware, the UK has been hit really badly at the beginning because the government didn't act quick enough. And unfortunately, the Black and ethnic minority communities have been hit particularly bad. So when the government did kick in and we started mobilizing key workers and health workers and asking people to go into lockdown, the first communities that were hit were those that were key workers. So the ones that were working as doctors, as nurses, as medical assistants, taxi drivers, ambulance people. And most of these people in the UK are of ethnic backgrounds. So when we saw the first tally of the number of people that died, unfortunately, most of them were from Black and ethnic backgrounds. So the Somali community within that context has been particularly hit. So we're talking a sort of a double whammy, a hit within a hit, because in addition to being part of the key workers, they also have cultural and religious reasons and socioeconomic reasons that make them particularly vulnerable. On the cultural front, the social distancing is not very much, and this is something I don't need to tell you guys. We tend to be really close to each other. We hug each other when we see each other. We don't do a wave from 2 meters away, So that proved to be quite a bit of a challenge. And then for religious reasons, obviously, we pray together, we stand right next to each other. And again, that doesn't facilitate the 2-meter social distancing rules. But then there's the socioeconomic layer, and that seems to be the bigger culprit in terms of making the Somali community particularly vulnerable. They live in overcrowded housings, and so that means often we have more than the number of people that should be in a particular house living together. And then they're also living intergenerationally. So we're talking grandparents, parents, and children living in the same household. Sometimes it's extended families as well. So we're talking uncles, aunties, cousins living there. And so that makes them particularly vulnerable, especially when some of those members of that household are then key workers that would go to the hospital and then come back and then bring the virus back. Or they are taxi drivers that are going back and forth, bus drivers, train conductors, and they'll be bringing the virus back home. So that has been the main issue that seems to have made the Somali community here in the UK a particular vulnerable group. So what the community has done quite quickly.
Yes.
I feel like I'm hearing an echo. No, it's gone away now. Good. Okay, so what the community has done is to quickly realize that there needs.
I think, Jamal, you have 2 devices.
Okay, I was trying to.
Yeah, and if you have 2 devices, it will be just like echo.
Thank you.
Yes, please, Jamal, remove one.
Thank you.
Okay, we're good.
Go ahead, please.
All right. So what the Somali community here in the UK quickly realized is that 2 things needed to happen. One is to start raising awareness. There was a lot of confusion that was happening, and that wasn't limited to the Somali community. There was confusion across across the UK. Government guidelines weren't exactly clear and transparent. So some people would have, would understand it this way, others would understand it in another way. But there were a few things that needed to be really clarified that were already established within the wider community. And that is understanding social distancing and understanding how COVID-19 actually works. There was a lot of sort of rumors going around about what the virus is about, what it is not about. A lot of people believe that it was, some kind of mild cough. And so you might be, having the flu for a bit and then you'll be fine. So there was a lot of misinformation that was floating around. And what the Somali community here in the UK did really well was to galvanize community members and organizations across the UK to come together and start putting together awareness raising campaigns and communication tools that would then be distributed across Somali TV channels to actually explain what COVID-19 is, how it spreads across the community. And then it was easier to explain to people how you can then adhere to the social distancing rules once they understand the context within which they need to be applying social distancing. So that was done really well. And then, that was followed up by social media campaigns. There were social media groups that were created, like WhatsApp support groups for the family members of those that died. We had the main Somali community organizations come together to then also create a pressure group to lobby the government that they need to start paying particular attention to BAME community members, and especially the Somali community, because there was this blanket slate approach to everyone. And the COVID-19 is not affecting everyone. It really started to highlight the inequalities, the social inequalities, the economic inequalities that exist within our society. And so, policy papers were drafted up that were based on evidence that was gathered across the community. And then these were shared with different institutions of the government to start bringing attention to how COVID-19 is especially affecting Black and brown people. And the Somali community being a part of that. So these are the kind of activities that have been happening here in the UK. At the global level, the Somali community has also been really active. There's an organization based here called the Global Somali Diaspora that has been creating awareness in different countries where there are large Somali populations. So they do weekly sessions, Zoom sessions, where they would bring in Somali diasporas in Norway, Somali diasporas in Sweden, Somali diaspora in Australia, and so on, where those then come together and talk about the specific issues and conditions within that country and how it's affecting them, but also how they are rallying and the sort of silver lining that come out of these get-togethers. So that's the kind of overview I wanted to share with you guys, and I'm happy to answer any questions you may have.
Yes, thank you very much. Can you hear me now? Is it better? Yes. Yeah, I had a question. I had some question here for you, but it seems that you've answered most of them. I wanted also to only ask, most of the Somali or other minority groups in the UK have been working essentially in the low-skilled work. Can they work from home? And how is the access to health, among the marginalized groups, access to reliable information? Could you maybe touch on that again?
Yeah, I mean, this is a really good question, because these are the key problems that we've been dealing with here. We've got a large proportion of our community that are essentially what you've correctly identified as working class people. So what we're talking about is that they often do what's now become high skilled. I really want to make that distinction. We tend to refer to them as low skilled, but we've really seen how indispensable these people have now become. We're talking, people that are waiters, taxi drivers, bus drivers, receptionists. These are people that have now become literally part and parcel. You cannot function without having them on the front line. So, and the Somali community is a big portion of that working group. But unfortunately, it also means that a lot of them have the sort of privilege of having a job, because there's been a lot of job losses that have come, unfortunately, as a result of COVID-19. But then it also means it exposes them to risk every day, right? And so they're constantly dealing with having to shield their family members, having to, if they can, those that are in a position to shield their family members, and others, they have to work around the fact that they may be putting their families at risk and bringing the virus back home. So they are disproportionately affected by COVID-19 simply because of the jobs that they do, and that's those that still have work. I mean, a lot of people still have lost their jobs because they work in the service sectors, you know, the customer service sectors, and these sectors have essentially come to a standstill. I mean, we're 4 months into lockdown now, and we still don't have restaurants and bars and cafes open, and so that means, you know, anybody that worked in those kind of jobs has been without a job. You know, the government has provided what they call a furlough scheme, which pays 80% of the wages, but that hasn't trickled down to every single company and every single organization. So a lot of people have been affected economically, as well as being affected, obviously, health-wise. So that's the issue that we've been dealing with. The question about the information, that was a problem at the beginning, but I think a lot of work has now been done where people are more aware and they know the channels to look for when they want to attain the right information. So I think that situation has improved a bit now.
Thank you very much, Dr. Idil, for your input. And I think we'll have a question and answer session a bit later. I would like to go forward to Yusuf Noor. Thank you very much, Yusuf, for joining us today. Yusuf is an experienced business leader and a trainer, and he has worked extensively in the business area, and he works also, he's a corporate leader also in the UK, and he has worked also extensively in Somalia. I would like him to introduce himself, and also, Yusuf, as you introduce yourself, please also go into the effect of joblessness currently with COVID-19 and the economic impact of other migrants, and also particularly Somali migrants in the UK, and how that affects also remittances back home, and how it affects multiple people, not only in the UK, but all the way to Somalia and other places. Thank you very much.
Hello, everyone. I hope everyone's well. My name is Yusuf Noor. I'm based in London. I just want to thank the VIDC for organizing, and Jamal Mataan and Suad Mohamed for inviting us to share a platform with such an incredible people and to bring value to the community. So my name is Yusuf Noor. I've been living in UK for a very long time. By profession, predominantly in business retail. I worked in retail for 13 to 14 years. That was my speciality in terms of consulting and leading and developing businesses from ground floor to all the way to a strong revenues within the UK. My background especially is working within the youth and also developing personal effectiveness in the community. If you think about the Somali community, 78% are under the age of 18, and we have a young community. My role for the last 3 years was to travel around the world, and from Mogadishu 2019 January to all the way to Minnesota 2019 July, to work with the communities around there and really inspire them to do more in terms of finances and develop a strong economy within where they are, and they're taking part of their host country. So for the last 3 months, we went and took part in as a consultant to build the largest ICU hospital in UK to cover it's called the Nightingale Hospital. I'm not sure if you heard of it. It's in the UK. It was predominantly to cover the overflow from hospital beds and to an intensive care environment where we changed an exhibition center to a hospital. So I was part of the team that were mobilizing, and I saw firsthand how that impacted our community. I know Idil has beautifully put how the community was impacted particularly. And if you even look at the Financial Times, that the report they released last week or a week before, that minority groups in the UK were hit hard, and that's not anything that's hidden. But if you look at particularly the Somali community, the numbers cannot be identified how many people died because we don't have a certain Somali ethnic group within the UK that they can report, particularly Somalis. So with that being said, where it'll explain where we were, but when we think about business, when we think about how that impacted jobs and financial aspects, if you look at 40% of UK bus drivers at one point were Somalis, 40% of London bus drivers were Somalis. And if you look at the taxi drivers who were self-employed were Somalis. So if you think about that gave us a back foot, because when there was a scheme to cover people who were told to stay at home called furlough, as Ilan mentioned, but that has not covered financially within the self-employed community. So it took a while before the government actually took action and laid that back to the community, or Somali community, and offer them a grants where they can borrow money in terms of and universal credit, which also hit financially for the EU Somalis who traveled from the EU countries to stay in UK. They had nothing to claim other than a universal credit, which has been extended to November. So in terms of financially, if you think about it, when taxi drivers and frontline workers were at home with no finances, then it hit the remittance market. If you look at the Somali community worldwide, send back home about $1.6 billion to $2 billion a year on remittance companies, which was put out there by the World Bank. So when you look at that, and the World Bank predicting that you would go, and that will drop by 20%. So 20% of that, which is 2.5 GPD of Somalia, will drop. So that was being a real challenge, because when you have single mother parents or father parents working in the UK as a front line, and their kids are at home, and they cannot go to work because they can't find a daycare to support, or while they're at work, that really hit home. And then on top of that, when the most difficult part was droughts hit in Somalia, floods hit in Somalia, the COVID-19 pandemic hit Somalia in one time. With the diaspora who was sending $1.6 billion back home being at home jobless, and the government backtracking for the UK community. So that was a real challenge for us. And if you look at UK, predominantly the people that were affected were care home workers. And if you look at 40% of Somali women who are working care homes, and that really affected us. And there's a story, even my sister-in-law's cousin who were working in a care home contracted the disease, COVID-19, and went home to her mother who was living with her, who was elderly, and the mother caught it, and unfortunately she passed away. And those were the touch points it talked about. And then we had to get the community to really, not just the financial struggles, but in terms of to talk about the impacts it had in terms of who can support, who can put the word out there to communicate the effects COVID-19 had on us. And British Somali Medical Association, doctors and nurses were putting information out there. Even as Idil mentioned, global Somali diaspora groups, anti-tribalism movement, put a lot of information out there to support the Somali community. But you can put as much information out, if financially there's a hit, there was nothing else to support with other than the social distancing and aspects like that. So that's been a real challenge. But what the good news is, the Somali government, if you go back straight into Somalia now, there's a deficit in terms of a budget, and the World Bank have approved in May 2015, 2020, 137.5 million for Somali response to the drought and the COVID-19 and floods. So 70% of Somalis are poor back home. So with the lifeline of the host countries in the West, people being out of job, you can understand the impact it will have. And 1.7 million Somalis, it will affect that. It will be supported with that 137 million. And also in June 2020, June the 23rd, World Bank approves another 55 million to sustain Somali fiscal response on multiple crises, which is positive. So we have those support, but prior to also lack of healthcare systems back home, and without any remittance money flowing to Somalia, with 20% being dropped, and with the droughts, it's been a real financial challenge. So it's something that we're working with. It's something that I always advise the Somali community to be self-sufficient. We need to have a lot of entrepreneurs, a creative community. I always ask them, when you look at the world, there's 7.8 billion people, and there's only 2,200 billionaires. And out of that 2,200 billionaires, 700 of them are from the United States, and 300 of them are from China, and 150 of them are from India. So if you look at the world's biggest economy, they have the best business models, or the biggest companies, and the most advanced people. So I do always say, you know, we need to build businesses that create jobs. You know, we need to be self-sufficient in the West. We need to finance. So that's why I go around and talk about the importance of personal development, the importance of businesses. When I went back in Somalia 2019, we had an event for Somali Business Awards where the finance minister was there, and the Dahabshil, the biggest Somali company, and World Remit and etc. remittance companies, and were there. And I talked about the importance. This was 2019. Importance us moving from, because when you look at the streets of Somalia, and you look at, they have this entrepreneurial mindset. They're selling mango. They're selling tomato. They're a social community that in the front line. And I spoke about the importance of us as a community back home, working on those businesses and developing young talent, CEOs who build and become creatively, who can self-sufficient, like America, who has 700 billionaires who support charities and build schools. And so, yeah, so that was an important talk I talked about in Somalia, and now we're working on it.
Thank you very much. I think there'll be a lot of questions that will be coming up on the chat. And once we start the question and answer session, I think some questions will be directed towards you. So I'll go further and invite the director of HIRDA, Fatumo Farah. Is she with us here? Yes, thank you very much, director of HIRDA. Please, I would like you to introduce HIRDA. Is one of the oldest organizations, is more than a decade now, going to the second decade in Holland. It's one of the biggest organizations of the diaspora community in Europe. Please, Fatuma Farah, introduce yourself and tell us about the scope of your work and how COVID-19 has affected the effect of COVID-19 in Holland and also the Somali community in Holland. Thank you very much.
Assalamu alaikum, Damantin. Thank you, Jamal and Saad, for inviting me this summit, Zoom. As you have said, HIRDA is one of the oldest diaspora organizations, actually founded in 1998 in The Hague. We have been working in Somalia about 21 years, but not only in Somalia, we've been also working here in the Netherlands when it comes integration and diaspora engagement. When it comes COVID-19, actually, it hit everybody in Somali community everywhere in Europe, actually in UK, in the Netherlands, in everywhere. UK was the most actually affected, actually, Somali community. When I'm talking to the Netherlands, actually 50,000 people are tested, about 6,000 are died, and about 20,000 was actually in hospitals. So in the Netherlands, it's not a big country. It's about 17 million. But the disease is impacted very hard. And yesterday we had total lockout. And so actually everybody can go everywhere. The events
the lockdown was lifted yesterday.
Yesterday, yeah,
okay.
from 1st of July. From 1st of July, so people can go everywhere, but the basic rules has to be actually respected.
Followed, yes.
1.5 meter and washing hands, everything. But sport events can be organized. People can organize events. People can come together. So it's very easy. It become very easy. So the problem is that people are talking now is the second wave of the disease. And so that is actually what the government is now saying. We should have to be very careful that the disease comes back and hits again, and then we should have to go back to all the rules that we have actually. So it is very, very important that as a Somali community that we should have to respect and follow the rules. And they lifted the lockdown, but it's not that the disease is get away. The disease is there because there is no vaccination yet, there is no cure yet, so it can come back very easily. So what we do as a Hirda is we started in the beginning, we started to translate the language actually from the Dutch language to Somali language so that people can understand it very easily. We also started helpline and actually get some Somali professionals in health. So we got almost 12 people who can answer the questions of the people. So the number, the helpline was national. People can call and ask a question if they have problems.
From everywhere in Holland.
Everywhere in Holland, and it was Somali, very easy. So you can call and say, okay, I have a problem. I think I'm infected, or maybe I need to talk to someone. So it was very easy to talk because there was 12 people waiting to respond, and that was very good. But people were not calling. That was what we have seen, because the sick disease was a little bit. People were afraid to say I'm infected for COVID-19. It was very difficult.
Was there a stigmatization within the community that told people not to talk about it or to say
exactly
they're affected or they think they have the symptoms or something like that?
No, they were stigmatized. We have cases that people was infected disease and they were not going to the hospitals, and they were afraid to say I'm infected, and they were going to the houses and visiting the people. So there was a little bit a problem of the disease actually. So what we have done was we raised awareness, and we it was very easy to call the line and ask questions. What we also have done was actually organizing each week on a webinar to talk about the community, and we invite Somali professionals in the Netherlands and an impact of the COVID-19. So and that was a little bit better than the helpline. People was reacting, asking questions, and we could reach also a little bit more people than before actually.
Yes.
So
Yes, I also wanted to ask you about your work in Somalia in terms of development and the work that you do also not only in Holland in integration and among the Somali community, but also the work you do in Somalia as Hirda.
Exactly, yeah. So what I was just talking was like our impact of the COVID-19, the Somali community here in the Netherlands. But actually, as my prior speakers have said, COVID-19 also impacted Somali community there. And actually, as a Hirda, we have been working in education, and what we have seen was education was impacted very hard when it comes to the rural area in Somalia. And there was online schools, but somewhere in Somalia there's no internet, there's no instruments that people can follow education. So we've seen almost 80,000 children without school in 3 months, and still they don't have it. So that is the problem that we face as it comes to education. And what we have been thinking was, and we have also written to the government, and especially the Minister of Education, our focus letter for education for everybody, not only children in the big cities like Mogadishu. And the big cities, they might have some internet, although it's not enough, but the rural area, you don't have that actually. And that is impacted very hard for the children in a rural areas. So what we said was like, how can everybody get this education? How can every child get the basic education in the rural area? And that is something that the people are thinking about, to have maybe the solar system, is the internet, mobile internets, I don't know, anything else. But it was very impacted, and we're getting, people contacting us and said, how can we give the children education when the government cannot reach those children in the rural area? And that is actually the challenge we are facing. The second challenge was actually that we've got was that some of the schools were private schools, and the parents could not pay the fee of the school.
Yeah,
and the teachers cannot be paid. And they were forced to close the schools. That was one of the things that we have also seen. And it is coming from the remittance that we were talking now. People cannot send money home because they don't have that money. So it is, the COVID impact has actually the Somali community hit it in the Europe or in the diaspora, but also in Somalia. And I think it is a challenge to find out now, how can we actually support the children in the schools? How can we, and especially in the rural area. And I'm not saying the rural, why I'm saying rural area is our schools are based in rural area. And we have been supporting 80 schools, for example, in rural area. And we have seen that all of them were closed. So, and the challenge that we have now is, how can we actually support those children in schools? And how can we also support the children who have actually education, gap? Because the 3 months or 4 months that the schools are closed, the children didn't get a school education. So they have that gap. It's not only the children in Somalia, but also children in Europe. Somali children. But because, for example, tomorrow we have a webinar for education impact COVID-19. And we have also organized some other, webinars. And what we have seen was like, that parents who cannot support the children for education. Either they don't have level of education that they can support their children, or they don't have instruments, the computers, the laptops, all those things. So the children are, so it is a challenge how we can support as a diaspora the children, Somali children in Europe, but also in Somalia.
Before you go to the next invitee very quickly, there was a big event that happened in December, I think last year, organized by Hirda, asking for all the diaspora communities to come to Holland for this event. Could you maybe shortly tell us about the event and how it went and what was about?
And actually, as you know, as Hirda, what we do here in the Netherlands is a sport events. And we also started 5 years ago Hirda Achievers Award, which is actually an award we give the Somali communities or Somali individuals who have done extraordinary work, and especially our objective is to encourage the young professionals or young entrepreneurs just to do something so that they can inspire the others. But the sport events are very popular. One of the sport events is actually July 1st. We organize always July 1st, but this year we canceled because we couldn't do that. The decision of the government came yesterday, so it is very late to organize that one. But the one in December will be organized actually, and now we are getting some support from the government, and they're saying you should have to organize. And actually, as you know, a lot of Somali young males are inspired to be part of these events, especially, and this big event, a sport event. And besides sport events, we do also talking and dialogue within the young generation, and we talk about how can we support each other, how can we connect the young Somalis in Europe together. So it is a big event actually, and it is an opportunity to bring Somali people and especially young generation together through sport. And we know that sport is very, very important actually. We got some calls now, and they said, when are you starting actually that events? And people are asking registration now, and I said, no, we still locked down. How can we start it again? So sport is very, very good thing to bring Somali community together, and I think it is something that we can use for the awareness raising when it comes for FGM and peace building, everything that we want to do that, and especially for young males, I think it's something that we can do. We also include like 2013 for the women and for basketball, but we didn't succeed that because we couldn't get funding for that. But we are still willing to do that actually. And December this year, it will be organized in 19 and 20.
Thank you very much, Fadumo. And I will now let Suad to take over from here, before I come back and then open the question and answer session, whereby the speakers who have already spoken, the questions that will be directed to them, and then we'll go further. Thank you very much. Suad, please go ahead.
Thank you, Jamal. I would like to invite Hamdi Hassan. She's a journalist and working in Austria and also interpreter. And I would like Hamdi to introduce to herself and her work with the diaspora community in here in Austria and back Somalia. Welcome, Hamdi.
Hello, everyone. Hello, Suad. I think the connection is there.
Can I
Can you
repeat
hear me?
Yeah. Do you want me to repeat the question?
No, it's like we could be so bad networking.
Okay.
I think now it's okay.
I can hear you. Yeah.
We should try speaking slowly.
Hello, everyone. Sorry?
We can hear you. Go ahead. Go ahead.
Go ahead, Hamda.
Good. Thank you, everyone. Thank you, Suad and Jamal, for having me. I'm really glad that I could attend this important meeting today. I am a journalist living in Vienna for just few years. I'm from Somalia, and I worked as a journalist in Somalia, different cities or different regions like Somaliland, Somalia, South and Central Somalia. I came to Austria about 5 years ago, and I'm working with a community radio Orange, and different magazines. I'm also translator, interpreter at different organizations like Himayat, Jugendamt, other different organizations about who works about asylum and health. Sorry?
We can't hear you very well, Hamda. Could you
hear you guys.
Could you hear?
Can we, Hamda?
I hope now it's better. Can you hear me?
Yes.
Good. Suad, it's not clear.
No, your voice is not clear. It's like the voice coming and go up.
Shall I cut and leave and come back? Maybe that will help. Do you think?
I will try to see the questions who have questions to the other speaker. Okay, you can go and come back. We have
okay, I leave and I come back. I hope it helps.
Thank you, Hamda. We had a question from Dr. Umayma before to Idil. She asked, she would like to know how big the Somali community in UK. Dr. Idil. Dr. Umayma, she asked you the question that how she would like to know how big the Somali community in UK.
There aren't any official figures, because Yusuf said earlier that we don't officially record the Somali group as an ethnic group within the national statistics. So they are often, ticked under Black African or Black British. Sometimes people might choose other, and then underneath it write Somali, but there isn't a systemized way of actually recording how many Somalis live in the UK. There are estimated figures. So for example, I think 2013, DFID, the Department for International Development, did a study where they were doing the mapping of demographics of ethnic populations in the UK and their relationship with their homelands. And one of the figures that they've estimated was that they are between 380,000 and 400,000, with majority of them, about 200,000, living in London, and then the rest dispersed across the UK. So that's the figure that I think would be closest to the actual figure, but I think it's probably much larger than that, because one of the things that these kind of official statistics don't account for is things like the multi-generational households that live with each other that I spoke about earlier, for example. So you might record the father and the mother and the children, but then there might be extended next of kin that are living in the same household that don't get recorded, So I can give you that kind of estimate, but I suspect the figure is larger than that. Maybe Yusuf can chip into that as well.
Thank you, Dr. Idil. Also, Dr. Umayma, she asked Holland, how's the situation in Holland?
How big the community also in Holland, if it is the same thing?
No, actually, community in Holland is well registered. It is about 40,000. 40,000 Somalis are living here. But actually, almost 30,000 are already left to UK. So I think more than 30,000 are left to UK in the years of 2000, I think, or before. So it's about 40,000 now. So and it is, you know, in the Netherlands we have that strategy of spreading. Actually, we have you know, Somalis are not living together in one place. They are living all over the country. So some of them are living in the north, somewhere you don't know. So we know from the Central Statistics Bureau, where, you know, you can get the numbers from.
From Statistics Bureau.
Mm-hmm. Yeah, Statistics Bureau. But actually, the Somali community are not actually groups within the big cities. For example, in Amsterdam, you have only 2,000 Somalis are living there. So it is spreading, and that strategy they use just to stimulate and improve the integration issue. So that is actually Somalis.
Abdul Wahab, you have a question? Yes, Abdul Wahab, you can ask the question. You have it to Dr. Idil.
I would like to ask Dr. Idil how this distance learning affected students at universities and also at schools. Thank you.
How long do you have? That is such a big problem that we're dealing with. There's two problems that seem to be the really pressing issue. One is the ability for students to learn online, because students have different ways of learning, right? And so a lot of them need to be in front of their lecturer and be able to, you know, be in close proximity to ask questions, to engage with them, to also engage with their peer groups and other students. And so what online teaching has done is removed all of that out of the equation, right? So you've got to learn online, and you've got to do it on your own, you know, even if it's engaging virtually with other students and other teachers. And that seems to be a problem for a lot of students that we have, especially students that live in overcrowded housing, where there's a lot of distraction, where they don't necessarily have time set aside for their studies. We also have problems with students that have learning difficulties. And so the ones that would normally, if they're on campus, they have hands-on support, you know. But again, that's been removed. So it's proven to be really challenging for the learning side of things. And it's also proven really difficult for the students that have particular learning needs. So that's what I would say, if I can put it in a nutshell, because it's a huge area that has affected students, and it's been done so suddenly as well. You know, it wasn't a kind of gradual easing into. Here at the University of Leicester, for example, we've developed this program called Ignite, where it's a blended style of learning, where you've got some small class teaching where, you know, you can actually socially distance 10 to 15 students, but then the big lectures that we do that have to include 300 to 400 students, that is done online. And that means you're losing a lot of students that are just simply not included because you cannot draw them in. You can't physically see them and actually be able to, you know, to bring them into the discussion. So I think, you know, when we come out of the other end, we're going to see a lot of post-COVID-19 after effects that we're going to have to deal with, particularly when it comes to then closing the gap of the students that have lost learning abilities because of these issues.
The last questions, there's two questions coming now from Mara van der Beer. She said, first, this question for all expertise, I think for Yusuf and Idil and all of them. Did you see the difference in reaching and also giving information to man and woman?
In terms of UK, yes, because of the language barrier, it's been a challenge in terms of receiving information, and also misinformation has been massive within the community. At the beginning, it wasn't taken very seriously, especially when you look at COVID-19 pandemic. So there was a lot of misinformation out there, and which was rectified, as Idil said, later when the community came together and messages were put out there from organizations. And really reiterated the importance of social distancing and etc. I saw it firsthand, to be honest with you, where I was working at a hospital. I was working at about 4 or 5 different hospitals in the last 3 months in the UK. And I've seen Somali families arriving in the landing room where before unfortunately their family member is about to pass away, we have to give them an information about their condition. And then a mother will come with her children, and her husband is in the hospital. And I witnessed that in the first hand, and she's unable to understand English properly. And there's no translator with her. And her husband was the breadwinner of the family. He was a taxi driver, and he's in the critical care, intensive care bed. And the doctor and the consultant and the critical care nurse is sitting in front of the mother explaining the procedures and how his body is going to be buried once he passes away. And it was just, and they didn't have any clue of what, as is a pandemic through the whole world, but it was just a shock to her, unable to see him as well and say goodbye and to understand why. So yeah, I saw that in the first hand. I saw also the spread of the conspiracy theorists spreading that COVID-19 information. And I did say to them that it's important. I try my best to, if I had an opportunity to explain what COVID-19 is, how it spreads in terms of the scientific version of it. So if you look at it, if you look at it, COVID-19, 5 micrometer droplets. If the social distancing, they didn't understand why there was a social distancing in place. And if once I started to explain and spoke to the Medical Association of the UK and explained to them, look, the reason why we have the 2 meter social distancing is because there's a 5 meter micro droplets that come out of your whether you sneeze or cough. And that, when you look at a COVID-19, it's actually heavier than a flu. So those droplets drop quicker to the ground, so it doesn't flow, and it's not as thin as a flu. So while you be in a social distancing, it gives an opportunity for it to drop, and it gives you a chance. So information like that, was not really translated well in the Somali community, and they called it a bird flu. So that was one of the key roles that the community leaders
Thank you very much, Yusuf. I had to cut you there because we are running out of time now. We'll have to go a bit much more quicker. Sorry to everyone. I would like now to introduce our next speaker because we have a few people who want to give their inputs from Denmark, from Sweden, and also from Germany. So I will invite quickly Yasin, who works extensively within the Somali community in Sweden, and Sweden has one of the biggest communities also in Europe, to speak a bit about how things were, because he's made also lots of YouTube videos on COVID-19, and I think he's also aspiring politician later. So please introduce yourself briefly and your work in Sweden, and then tell us also how the community were affected with COVID-19. Please, go ahead.
Thank you very much. Thank you, Jamal, and thank you, Suad and CIVD in France. Thank you for having me. I'm sorry if my language is broken because I don't have English at the daily basis. So I'm not like the doctors and the people who lives in UK that use English daily basis. So my name is Yasin Abdullahi. I live in Sweden for the last 30 years, and I'm a teacher. I'm also a treatment assistant, and I also a Swedish politician. I have been a volunteer since 1997 in political terms, when I practiced in activist for to give Somalis get Swedish passport or Swedish citizens. The reason I did was the Somali passport was not recognized as ID documents. So to have that, so we make a deal with the Swedish authority that Somalis could have Swedish citizens in 8 years than the other people in normal way with the IDs have 5 years in permit. I engaged also after that uses related to reunion families with the refugees. I worked since 2008 and still working all laws that I was part of it. And
laws on family reunion.
Family reunion, yes. Parents or children who comes here in Sweden to have their family in here, also here in Sweden.
So you're advocating for that. Go ahead, please go ahead.
The real is that the problem is the same because when they go to the ambassades, when they go to the ambassades, they ask them for ID or passport, and when they come with a Somali passport, they don't recognize. So it's like it calls. In 21 circle or moving 21 article like that. Yeah. And let us maybe go forward about me. I think if you have some question, you can.
Yes, on COVID-19, Sweden was a special country. We read that there was no lockdown in Sweden.
Yeah,
people were led to do it by themselves. So please tell us, within the community where there was no lockdown and the way we are so, with one another in the cafes or many different places, how was it? How was the effect? Because we also had, or we saw a lot of writing telling us that Somali community was affected proportionally very high in Sweden, and there was also many deaths. Please, could you tell us about it?
And yeah, I of course we are specials, so we are special, so we have to do exceptional things. So to get all the world's eyes on us. The first case in Sweden was confirmed in 31st of January this year. It was confirmed a woman who was being in Wuhan province and come home back. At least, yes, of course, we have most of Somalis as they have coronavirus, and it was 19 of 12 death was Somalis. So that's why.
How many deaths again?
19 deaths, 12 of them was Somalis.
Okay,
so it's almost 2/3. Yeah, almost 2/3 in Stockholm, and it was going. The virus goes very quick, and we feel very shame. But the only things we could do is just do action and move forward in action. When I was told in 19th of March that the death toll was raising up, and I double check it. When you are in a politician, when you get information, you don't run immediately. You have to check it. Different ways. When I get confirmed, then I make a video that I'm telling my Somali fellows, my Somali people all over the world to be careful. And then
COVID-19 is real. It's not something to joke with.
No, as other speakers told you, or we share that people share videos and, you know, misinformation through the WhatsApp and Viber videos from YouTube or Facebook. So they think this is bad cough, and they think that it's not that serious. And then Somali Medical Association also wrote about it, and they, you know, more black people's in general death died than whites. So it makes more suspicious why only blacks, you know. So today is the total death today. I checked it before I went live here and joined you. It was 5,295 people dead. We are almost 8 times more than Denmark, Norway, and Finland together. To get those 3 countries together.
So there was more death in Sweden than all the other Scandinavian countries.
Yes, absolutely. So it's yeah.
Yes, thank you very much, Yasin. I think because of time, we have to rush you a bit, but during the chat, we might have some questions that will be directed to you. We'll be able to send those questions to you, but I'll have to go forward now.
No problem. Most of it, Somali problems and problems at all. I think I share with Yusuf, Noor, and Dr. Idil everything they told, and even Suad and Fatima also. So the most is likely, but these things you talk about, the learning, distance learning, that we have now very big, and it's a very big issue, because most of parents don't know how to teach, and don't know the language, Swedish language, probably here. So I'm trying to.
It was difficult for them to follow up with.
Yeah, my YouTube channel. I'm trying to give them some kind of encouragement, and trying to find some way that they can have. Children can have contact with not children, is like youth, because we don't close cafes, we don't close the elementary schools up to 9th grade, we don't close any workplace, everything is open with them. So the responsibility is not for the government, so responsibility is on us, and we have to protect ourselves to avoid the contact with the diseases and infected people. So I let other people talk, and thank you for having me again, and thank you for listening to me.
Thank you very much. I will go now quickly further to our next speaker. Our next speaker is Fatuma Musa Afrah. Fatuma Musa Afrah is an award-winning activist. She was born in Somalia and raised in Kenya, and she's also active in Germany. Fatuma has worked with the German Parliament and also the different European politicians and civil society with the support of Robert Bosch Stiftung. And she also a founder of her own organization, the United Action, and she has given speeches in different places, including the IPI Vienna seminar, both Saxony and Brandenburg State Ministry of Social Affairs. She's also consulting for them. And I would like to invite Fatuma to give her scope of work and tell us about also the issues she grapples with every time, including gender, as a gender activist, somebody who does also a lot of work with women. Please, Fatuma, you're welcome. Go ahead. Yes, we can hear you.
I've never used the earphones to speak before. First of all, I really feel so honored and privileged to really see a lot of very diverse Somali community that are expertise in different fields. But I would love to extend my very special thanks to the incredible Suad and my brother, who have done incredible job, amazing job, and of course the organizers, VIDC as well. Yeah. I think time is a big issue here. I will try to stay very precise and to the point, so that maybe we can discuss together. First of all, my name is Fatuma Musa Afra, and I originally come from Somalia, but I was raised in Kenya from a very childhood age. And I live in Germany less than 6 years here in Germany. And I've done very diverse work, but I'm committed and working on women and girls issues, particularly the minority women and girls, newcomers, I call them newcomers, and refugees, that's the term. And we try to give the best support we can for these women. And I don't like to use the word integration, but rather we try to create a safe space for inclusion where they get a chance to, you know, get empowered, you know, some different empowerment, you know, education and knowledge. Sorry, it's very loud. Sorry, it's very loud. And yeah, that's what we try to do. And we work with people who are specifically in refugee camps in 2 different areas in Germany. Besides this organization that I founded, I do a lot of different things, but I don't want to get into that. My activism is very too wide. And but currently, regarding the situation of the corona, I think this is a very big solidarity issue around the world with the COVID-19. But particularly in Germany, I think you are aware of it, how they managed, and the situation is not the same like other European countries. Things are a bit better here, but of course, the virus is a dangerous one, whether you are physically affected mentally or psychologically. But particularly the women we work with who live in refugee camps and other shelters, they're really left behind, not just because they got the virus physically, but they're mentally left behind because they're isolated in refugee camps and other shelters, even though they don't live in particular refugee camps. But at the same time, they don't have so much contact, no family, no support. And we work very diverse with very diverse women, but of course, also a special focus on women from the Somali community. And we try to figure out how is the best ways to structurally support them. And I don't know if you know well, but the Somali community in Germany, we're really not that well centralized in terms of unity. But of course, every region has its own self-organized, you know, migrant groups. But of course, they're trying their best, and we're figuring out how we can, you know, do something together better. And that's why I organized it successfully. And it will hopefully happen in September, October, depending on the corona situation. We want to bring together all the Somali women activists and role models here in Germany who really did, whether it's by business, like she has a business, or she's an expert in different fields. So we want to bring them together to really think together how we can move forward as women, and also thinking more on the development perspective in terms of like women representation and leadership and the different issues that are out there. But I want to focus more on the positivity side of the Somali women here in Germany and the young girls, because I believe when we come here, particularly in this country, we have one name, refugees. But we want to bring out what we are capable of as women. I mean, we stand here for all women, but I want to see more on like touching on the community I particularly come from, even though I am neutral in everything. I love to be welcoming everybody. United is what I believe in. But I also believe that it's a big responsibility on my shoulders as a woman to find out what is it that we can do together as Somali women. Because on the 11th of July, this next month as well, we are organizing a demonstration about the Somali situation in Germany, because there are a lot of young Somali people who are dying in German jails that are being said they committed suicide. Don't forget, these young Somali, most of them don't have good role models, you know, people to welcome them, because they came here very young with so much expectations. The country situation is not really easy. There's so much different problems like any other community. But at the same time, with all the pressures. They come here with the expectations, with no family support, no other much support available. They are lost in between the cultures, and then they don't know where to go next. And then they end up in the wrong actions, you know, and then they end up in jails. And then all of a sudden you hear they committed suicide, they killed themselves. But these are realities we are dealing with. And not only this, but there are a lot of also lack of family reunification for the Somali mothers who left their kids and came here to look for better life. There are also issues of education in terms of the Somali community. There are a lot of different legal problems as well. There are a lot of issues, but that's what hopefully we are in the process of doing it, and we want to do it in different areas in Germany. We are not so much in Germany as Somali community, but we try our best. And yes.
Can't hear you very well. Yes, try again.
Are you hearing me?
Yes.
I felt like you wanted to say something. Yeah, and what I want to just say is that not only Somali women, but I think minority community women and girls are really left behind, especially young children, young girls. One of the big challenges we're dealing with right now in terms of women empowerment and young girls empowerment, particularly in refugee camps and migrant communities who live outside refugee camps in normal apartments. One of the biggest issues right now are the mothers who are left alone with kids who are homeschooling, who don't know anything, how to help the kids. They don't know the language here. They don't know the structures here. They don't know anything. So the kids who are going to school, they had some sort of system that was helping them with different incredible organizations that are trying to do something, but now they are left alone. And now comes to the point of information. Besides this, they have also a lot of misinformation. They have good information, wrong information from their cultures, from the country itself. So we're trying to navigate and find out like how is the best way to give them the right information. Yeah. But that is also a big challenge. But we are trying our best to figure out. And now we started to bring them in small groups, like because they have to respect the social distancing rules and regulation for the health safety reasons. So we are trying to figure out like how we can really bring them back, because they're losing, basic human contact. And this is one of the most depressing things. So for them, they're not physically suffering from the corona situation, but they're suffering mentally, and most of them, don't forget, most of the newcomer women or refugees and migrant women, they had initially, before this situation, contact problem. There was no much contact. There's so much distancing. And the situation here is very difficult with the political development of the AfD, the extreme right wing, the side of the politics. There's so much misinformation. There's so much discrimination. There's so much division that has been progressed between the communities. And we are fighting so much hard how we can bring back together the community and create this contact, even though it's not easy. If you have any questions,
a very
to be part of this.
Quick one. The work that you're doing in Somalia, or you've done in Mogadishu, or in the neighboring country, could you maybe, in brief, speak about your work?
Yeah. I basically went to Somalia for work while I was living here, besides that, I want to focus in the northeastern part of Kenya, where the Somali community lives in Kenya. I was supposed to, unfortunately, the flight is cancelled on the 8th of July. I got some funds to buy a land to build a women's center to empower women and young Somali on the northeastern part of Kenya. Unfortunately, now because of the situation, things are not easy. But this is a big dream I want to accomplish with the help of incredible people, individuals, activists, organizations, and of course funders who are doing this. So my main focus right now is, migration is a big topic right now globally. But if you look at the so-called developed countries, for them migration is an illegal thing. But to them, when they travel to our countries, they are expats, they are tourists, they are all these beautiful names you can call. But I want to fight for how to do this positivity on our side. Why is it that when you see somebody with this skin color, the first thing you think is these are beggars who came to this country to just ask for, legal ways to stay here? But we need to develop this, attitude, change attitude on migration issues between human beings, because movement is a basic right, and people need to understand that. And my hope is that, with the diaspora connections and with the diaspora exchange in these countries and back home where we come from, I hope we can think more on the development perspective, how we can, you know, bring home what is good from here and leave what's bad, but also bring what is good from there and bring it here, and what's bad, leave it there, and find out how to, you know, create this, you know, I call it, also auf Deutsch, Entschuldigung, sorry, I have to get it in English. I don't know, I normally don't speak good German. I'm pretending like I speak good German, but I don't. But I always call it a two-way journey. Yes, I got the right word. Yeah, it's a two-way process. When we are human beings and we try to think in this direction, we have to find out if they don't want people coming here, okay, we got you. But what about the inequalities? Because people are on the move, because they're looking for a better life. They're looking for protection. They're looking for a way to survive. These countries, I think Mr. Franz can prove me wrong. I mean, if you look at the German side, Austria, migration, you know better than us. And I don't understand why this kind of, you know, pretending not to know reality of life in terms of migration. I think, and I hope from this network, we can develop some sort of thinking towards the different issues that exist in our communities and how we can create, you know, a roadmap of how to bring both sides together to discuss about the different issues, not just because of the COVID-19 situation, but we have to think about sustainable solutions in the long term. But I also want to look so much into the young people, and my area of focus priority goes to women. Of course, we are together with men. These are our brothers, our everything. We are together. So thank you so much for having me here. And I'm looking forward to develop something beautiful together, that we are not just here together. And I hope we get out of this screen and come together individually so that we can have all the time. We are restricted by this machine, but I hope it will be there. And thank you so much.
Yes, great. Thank you. Thank you very much. And we have input from Denmark. But before I go to Denmark, I would like to ask Suad to continue with the questions for Hamda and to be brief, please, this time around, and I hope everything will function well. Please, Suad, go ahead.
Yeah, Hamda, wait, let me unmute. Hello, Hamda, can you hear me now?
Suad, hi again. Yes,
hi again.
I can hear you. Sometimes it's going to like check. I'm sorry, I will try to go straight to the points. And the project is that I was working on during the lockdown. I will start the program, the Radio Orange, which we called Corona Information in Vienna, which we produce different 5 languages spoken in Austria, German, English, Dari, or Farsi, Somali, and Arabic. This is like weekly program about Corona and about the new role is homeschooling. And we started, I think, the beginning of during April. The idea was end of July. March. We started to talk about what we can do, and we produced such a program 2004, I think, 15 and 16. So we follow the system, which we produced 5 different languages, which the people who live in Austria speak, and we broadcast the local radio and different radios in the different cities in Austria. We shared our social media accounts and personal contacts, and to reach the Somali people who couldn't speak German language or Arabic. To translate our own native languages. So I was the only Somali person who was working in the media this time and producing such a program. So it was really hard for me as a mother, as the only one person who, it was not easy at the beginning, but I tried to reach as many people as I could, and it worked a little bit. In Vienna, there are many Somali people, especially women, who cannot properly understand German language. So the homeschooling was the most difficult challenge that we faced as the mothers here in Austria, or I think everywhere. And it was not about only that or that the mothers or the fathers couldn't speak the language, German language. It was basically about the kids. We are the parents, we are the mothers and the fathers. They are not expected us to be the teacher and the mother and father. So it was, for example, I have 2 kids, and it was one of them so hard to accept as a teacher, me or the father. So they really had challenging or difficult times. So we changed a little bit the tricks that we were using. So I try to reach different individual and organizations here in Austria to help us, and about the homeschooling and how to deal with the kids who doesn't want to have a teacher and the parent as the same person. And so it helped a little bit. That was one of the also ideas which helped us to produce a show about homeschooling and how you can ask other people to help you. You can do it. For example, you have a child who goes first grade. So basically, if you can help first grade or second grade or even more, your child wants you to have as a mother or as a father. They don't want to sit and study with you. So it was helpful to contact a person from organization or individual friends to ask help and say, I need help. And to help my kids. For things, it was big deal. I'm also interpreter, translator, different organizations. So, for example, Himayat, they deal with the psychological. They are therapists, group of therapists and doctors. They help the people who have psychological problems. So there were many people contacting us and contacting them, asking help how to deal with this lockdown situation. For example, many Somali communities, they have more kids than the other communities, I guess. So, and basically we live. Hello?
Yeah.
Yes.
Go ahead.
Go ahead.
So basically we have difficulties at the housing. So, for example, a family who have 5 kids or 4 kids and 2 parents, and live in 2 rooms or 3 rooms. There is no space. All the people to study and home working. For example, if the father or mother is working in home office, it was really difficult. So we try to produce show about this topic, how you can schedule your time and how to divide the kids and how to share the small space that you have, how you can go out and breathe and take.
Yeah, you can finish your sentence, but we have little time and we need to be fast. Sorry.
Sorry. And I was also translating the rules or the rules about the restrictions. I'm sorry, about the coronavirus and how to deal with if one of the family member of the family gets sick, how you can contact and what you can do. And it was really a lot. And I'm sorry that we have less
thank you
and a lot of people are still waiting. Thank you so much again for having me, and thank you everyone.
Thank you, Hamdi. Jamal, it's to you now.
Yes, as we go now forward, I would like to give the mic to Denmark, the colleagues from SSPDO, to introduce themselves briefly and tell us how is the situation in Denmark and their work in Denmark and in Somalia. And then we'll be able to start with the chat questions.
Yes, my name is Abdul Qadir Gaal. I work as an employment advisor and social worker in the municipality of Copenhagen. I've been working for the last 13 years. As SSBDO, I'm serving on the board, and I've been doing there since the start of SSBDO. That was 2007. SSBDO is a civil society organization registered in Denmark, and have been doing both work in Denmark and also in home country, Somalia. Generally speaking, in Denmark, we have a population of 5,790,000 people. Regarding the COVID-19 impact, we have had both socioeconomic impact and also we have also experienced a death. Unfortunately, we have 10 members of the community have passed away during the COVID-19 outbreak. Denmark is one of the countries who have contained this disease, virus disease, very good, I think, because by the time speaking, 12,675 people have contracted with COVID-19 and 604 people passed away. That shows that Denmark has done its best to control the disease compared to neighboring countries, including Sweden. Coming back to how the community dealt with the issue, Denmark has had a lockdown from the 13th March this year, as corona outbreak was starting very high in the European countries. And then the Somali community has also decided, the community leaders have informed our brothers and sisters in Denmark to follow the guidelines and instructions of the healthcare authorities and also generally from the authority, and also to have a very good, provide very good information for the social settings of the community, including the associations where Somalis meet and also mosques. Immediately when the lockdown was declared in Denmark, we have closed the social settings of Somalis, associations and mosques. And also we have set up a WhatsApp group that we can exchange information and disseminate information, who got contracted, how many have been admitted to the hospital, how is the situation. So we have been always updating each other, the health of our citizens here in Denmark, those who have been in critical condition, those have been dismissed from the hospital, those who have been also passed away, unfortunately, how we can attend their janasa and burial. We have also had very strict rules. Only very few people with social distancing could gather in the burial place, graveyard. So we have done our best to also inform our community members and also to update each other and to help each other. In Denmark, the government has launched a support package to the companies who have lost the wage of their employees. And some Somalis in Denmark have been working as self-employed people. It has been pledged 40 million Danish krones to the small and medium-sized companies, and also self-employed companies and also freelance people could also apply this support, financial support to the government. So as an employment advisor, using my role in the community, I have helped so many small companies where Somalis were owned by Somalis, including self-employed people, the people who own the transport company or small shops, how they can apply this offer from the government. So I have been contributing my knowledge regarding the field, because I have been in the field for 13 years, and also following up if they have got reimbursement after the application. And if there is something wrong,
you have to help them with the application for these funds.
Exactly, the whole process, you know.
The whole process.
Informing first, because they call me and they tell me that they have closed the shop because they don't have you know, clients or customers. How they can get help from municipality and also from the government. So I've been informing them that there is this offer, this pledge from the government, financial support to the companies, that they can apply for all citizens having a registered company in Denmark. And then also following up if they have received the reimbursement, and also how they can manage. So this offer is open from the 9th of March up till you know, 31st August.
Mm-hmm.
Regarding the remittance, I think a colleague from England has mentioned, it's true, because Somali diaspora have played a very good role in terms of you know, helping their fellow citizens back home, not only sending you know, to their family members, but they have also contributed the, you know, private enterprises, and also sending the children to schools, paying their school fees, and also helping the Somali citizens back home for healthcare fees, because everything is private there in Somalia. So once these people have been laid off or kicked out of the job, then they don't have any income. They cannot support the family members, and they cannot also contribute the economic or GDP of the country, as the remittance played a very important role in the Somali economy. So the bottom line of my short presentation is that we are a very small community who know each other, who you know, always you know, exchange informations, and also the news. So every time there is a new you know, corona incidents, people were aware via WhatsApp or knowing from each other, the word of the mouth, you know, that we are familiar with.
I'll have to push you a bit more and ask you about your work in Somalia, the current work that you do in Somalia.
Yeah, exactly. SBDO has been doing both humanitarian and development projects in Somalia since 2007. The work we did include start from the life saving when it comes to, you know, the disaster of flooding, for example, in Beledweyne areas, and also the other you know, disaster for typhoon in Puntland, and also the IDPs. So we help from the life-saving, you know, intervention to development interventions, including also we have built also the schools, and also we have built a new library for the Somali National University. We have made training centers in Mogadishu, where younger generation have been given income, giving the women a revolving income as a micro finance projects. So many projects. You know, in Denmark, the Ministry of Foreign Affairs has a small branch called SISU, which provides, you know, the Somali diaspora can apply small scale projects, and then they can implement in Somalia with collaboration of, you know, local partner. Mm-hmm. So we had this opportunity to getting funds from Denmark and then implementing in Somalia with the collaboration for local partners. So we have done huge work in terms of helping our brothers and sisters in Somalia when it comes to education, when it comes to the clean water, when it comes to income generation, and so forth and so on.
Yes, thank you very much. Lastly, because time is going. I'll now give to Suad to speak to our last presenter for today, and then we'll open a bit of the questions, and then I think we'll have to end it there today, but we'll do it quite quickly. Thank you.
Abdul Wahab Adan is a teacher from Process School and also student from Economic University of Vienna, works in the western province of Somalia, and he had his own organization, Grass Aid, and he provides education for children. Please introduce yourself, Abdul Wahab, and inform us about your work in Somalia and Austria. What you do.
Hello, thank you guys for having me. As Suad said, my name is Abdul Wahab. I'm I'm a student at Vienna Business and Economics University. I'm about to finish my bachelor degree now. At the same time, I have been teaching the last 4 years as a mathematics teacher in different schools, different organizations. And basically, everything was set from different personalities. But the only thing that I maybe should target is that this learning, distance learning, because this affected me as a student and also my students in school. Since the university, our university decided to make this distance teaching, they only maybe they asked us every different things. The majority of the students in our students, and they on their information for these people, and but we had but Somali people or minorities share the to study. Or they even don't have enough a good internet connection. If you switch the room, is it possible to focus on this majority people and not to consider really this the thing that we found to teach also distance learning. Many of our students were not able to follow the teaching or for supporting. They have not the parents; those are able to support them at home. They don't have the rooms. This is also a big problem. How can I learn alone or with very different? One of the things that introduced it is that telling myself, I made a Somali language explanation of Somali language, how to use Anton app and use it. Those are learning the language, German language, how they can use it and learn it at home. It was very important. Some organizations like UNHCR shared also, and it's very helpful, I think. But okay, thank you.
No, I have other questions. I want to talk about your organization. I want to what do and how did your organization do mitigate this COVID-19 issues?
I myself, I set up an organization, and we are working on southwestern regions, Baidoa, Bakol, and Shabelle region. And we support. We give students, young students, the opportunity to go to school, and we pay them the whole school fees. What we did during this pandemic, we gave them a package. We gave eight kids. We gave them it was like 125 kids. We gave them clothes in order to go to have the new clothes and to also enjoy the like other kids. And what also our team members did is that our community awareness, telling them to stay at home if they can do. But if someone and getting there $2 per day and bring back to home, how can you say these people? But we did what we can. Thank you.
Thank you so much, Abdul Wahab. That was amazing. Next, we go to the question session.
Okay. So it seems that
unfortunately, I have to leave you guys. I'm so sorry. But I don't have. Can you hear me?
Yes.
Really. All I want to say, yes, sorry. All I want to say is that I want to see, hopefully, through this network, real action. I know there are a lot of incredible organizations, self-organized migrant organizations, and individuals, business people, call it from medical, social media, and everything, that are doing incredible work. University students, thank you so much, Abdul Wahab, for that courage, for trying what you can from your position when you are a student. Indeed, I can't imagine myself doing that, but I congratulate you.
Fatma, I think Umayma, she have a question for you. I think.
No, it is not question. You can continue, Fatma. I just want to add something about
all I want to say is I'm in favor always of action. There's a lot of theory out there, I hope to see something. You guys are touching heart to see very strong, advanced, activist, well-organized Somali community. Have you here? I don't know. Maybe Mr. Frank, you can touch in your money and give us transport for Suada to come here to our conference, because we don't have the best way to empower the Somali women by using the good role models that exist. And so I want to say is that I wish you all the very best. Let us act together, and I hope that we don't remain like this. We need to multiply each other. Always, I don't want to be the one in the face here alone. We need to bring other good heads, fresh heads, innovative heads.
Fatuma, may we have you here in Austria?
And keep working together. Unless you have a question, I would love to leave. Sorry.
Yes, thank you very much, because we wanted to wind up. Please, Umayma, if you could write...
it's just briefly, I'm very thankful to have me. I'm not Somali, but I consider myself in my second home. Yeah, and I would like to say that I work like more than 13 years in healthcare system. I'm a medical doctor, and I work very close with the Somali community. This type of meeting, sitting, it couldn't be possible 10 years back or 5 years back or 3 years back. I'm very proud of you, Suad, Jamal, and Hamdi. You are really one of the role models for Somali community here. It is incredible work. Also, Abdel Wahab, I just used to know you now. You are really working very hard as a community. You are, there is huge progress in Somali community through you guys, and thanks a lot VIDC for making it possible. Thanks a lot.
Thank you, Humayma.
Yes, we'll be wrapping up. I wanted to give to Franz a bit to speak about the coming network conference in October, and then I think that will be it for us today. We are already at 9. It's already 9. Yeah.
Thank you, Jamal. I have to say, wow, I thought after normally in these meetings after 1 hour you feel tired, but I'm not tired at the moment. I feel so inspired. You gave so much energy to us. It's incredible. I mean, I thank you very much all for your insightful and powerful presentations. You met so many challenges. We as privileged whites, we don't understand the pressure from Somalia, which is coming. You are very close with the families. And this is one reason why we want to organize a conference. I have put it in the chat, the date. It's such a great work done by you, how you responded. It's not a new issue, diaspora engagement, but it's a new challenge during this pandemic. And one objective is to make this work, this wonderful work, more visible in our societies. It's not visible, it's not enough visible, it's not so much respected, it's little funded. And this we have to change also the image. In our, I have to admit, partly racist, not all are racist, but we have a lot of racism. In development cooperation is a lot of racism. So this is one reason for the conference. And just to, I mean, you have mentioned why it's necessary to have such a meeting. But I see in UK or in Scandinavia or Netherlands, you are very good linked already. You are well organized. In smaller European countries like Austria, we can learn a lot from you. That's one reason, learning, because the communities from Somalia, but also neighboring countries, not so big. And that's one reason to organize it, to get the exchange. We also have invited people from Italy. We have to build up a network also in, let's say, in the center of Europe, on the continent itself. So we will focus on Somalia, but we also have friends from neighboring countries. Some are with us from Ethiopia. We had last year some events with the Sudanese communities. They are small but very active, and we also want to bring them in, because as Jamal is also working in the region, Horn of Africa. So this will more or less the framing, but the big question from my side is now that let us know who would be interested to come if traveling is possible. because I have already now the feeling I would like to meet all of you tomorrow to discuss the way forward. But I hope it's possible in October. Second, please let us know your expectations and issues, because you know the situation. We can be the host, but you have to make the framing of this meeting, of this gathering. And third, maybe you know also other initiatives, other networks. Maybe you have contacts to other countries. Let them know, and we try to invite them. All the difficulties, the financial issues, we will sort out later on. We find solutions, but let's go on. And this is, let's say, a kind of, I see it as a kind of process which started now in Austria, but you are much further in the northern countries, but we want to follow this. And the next will be maybe the next online meeting in 1 or 2 months, where we focus more on the way forward and on the planning of the meeting. And then it will be in October, and we should have, yeah, maybe a yearly event like this, but this is at the moment dreams. Let's do the next step before the next one. And so I have to thank you again very much for this participation, for your great presentations. Thank you, Jamal and Suad, for your wonderful cooperation before this meeting and your wonderful moderation. And now I want to give back the floor to you.
Yes.
Jamal,
Go ahead.
We answered it from you to Yusuf. Mehret K, she have one question.
Yes, but we are wrapping up. I think this question, Mehret, thank you for your question. It's a brilliant question, but I would like Yusuf to respond to that question some other time. And I will give you my word that this will be sent to everyone.
Meher, Yusuf, you can put your contact email to Mehret that you can answer her this question. And everyone, Fatima, Idil, everyone, if you can please put in the chat your emails and people to contact you if they have questions. Thank you.
Yes, thank you very much. Thank you to Dr. Idil personally. Thank you to Yasin. Thank you to Abdul Wahab. Thank you to Yusuf. Thank you to Franz, Mehret, Fatuma. Thank you very much. Suad. I'm thanking Sita, Heather, who is with us today. Thank you for coming. I can see Mara, who used to be my colleague before. Mara, thank you very much for coming. Hamda, Lisa, everybody and my colleagues from Denmark. And thank you very much. I hope that we will continue with this conversation in a different setting. And yes, thank you very much for coming. I have nothing to say. Wad mahadsantihin, nabad geliyo, ma'asalam.
Thank you. Thank you. Have a nice day.
Assalamu alaikum. Ma'asalama.
All right.